The issues are related to, a lot of times it is misconceptions about the vaccines and being able to turn to reliable sources for information. And and that kind of segues into a question for you, Glenn, related to what you're seeing in your practice,
Right.
and trying to get correct information out there to your patient population.
Yes, yes. So, most immediately in our practice in Newark, New Jersey Medical School, the patients that we serve, a very high proportion agree to immunization. They trust our recommendation. They trust the recommendation. And when there's an explanation necessary about potential side effects, really the facts are upwards of maybe 5% will get local swelling, pain, some redness. A much smaller proportion may get a mild fever, a sense of malaise. But beyond that, really the side effects overlap with those if you were just to give an injection of saline or salt water. And I think that's a very important thing to note. I think the challenges are coming now in other parts of the country. So the observation back with the outbreak of 89 to 91 in the USA, mostly in urban areas, under-immunized. Some of it had to do with access. Some of it had to do with just single-dose immunization. It may have had to do with waning immunity. So most of the outbreaks were in urban areas. Now it's the reverse. It's in suburban areas where there is a lot of vaccine hesitancy. So that's the area I think that has to be targeted, finding better ways through social media, through helping to give the providers the tools to translate the science or the facts to their patients. That's becoming increasingly important.
Well, public health wants to help providers as well, because we know from a lot of research examining attitudes toward vaccines that parents will always cite having that recommendation from the providers as being the number one source of trusted information, and that's what influences parents to vaccinate. And so, the CDC, the state health departments like New Jersey, all have various toolkits that help clinicians, because we know that it's a multifaceted approach to try to get correct information out there,
Yes.
like from trusted sources. So, for example, CDC has a variety of resources that are available to help patients have conversations with patients, and have developed evidence-based strategies related to how to approach parents. Because the first thing is recognizing that a lot of times assume that the parents are going to accept the vaccines in the vast majority of situations, but then also to make that strong recommendation and be available to offer any sort of answers to questions that they may have, because it's understandable why parents want to ask these questions, because this is their child that they're
Yes,
trusting
of course.
to you.
And I think for parents, the CDC website is a fantastic resource. The AAP website for providers and the New Jersey AAP website locally. And interestingly, in the state of New Jersey, there's been various legislations since the decisions, if you will, or the laws around enforcing compulsory vaccination are at the state level. There's been pending legislation, number one, to insist or require all parents to go through some sort of counseling before they opt out. And I think that's been very popular in that then the pediatrician or other provider could use some of those tools to engage the parents and take those that are sitting on the fence, which, as you point out, are the highest proportion and can be persuaded in the overwhelming majority of cases. More recently, I think in part in the wake of certain of the outbreaks we've been seeing globally in the US and locally, there's pending legislation to limit exemption to only medical.
Right. I think, unfortunately, sometimes we're always the victims of our own success. Vaccinations, which as a practicing physician, as a public health practitioner, that we are really proud of the impact that vaccination has made in terms of curbing vaccine preventable diseases. And not seeing some of the diseases rampant like prior to the pre-vaccination era, as we call it, where you were seeing hundreds of thousands of cases of measles or other vaccine-preventable diseases, that not seeing that sometimes gives people a false sense of security sometimes.
Yes, and these were, and I'm reminded of the children's book writer Roald Dahl, who lost his daughter to measles. When she was 7 years old in 1962, just before the vaccine was available, she died from measles encephalitis. So he actually dedicated subsequent books to her, and he spoke very forcefully in 1984 about this, when he said, if you're a school-age child that has not been vaccinated, you should insist that your parents vaccinate you. So that could be another message to parents the next time they read to their children, they can remember the experience of Roald Dahl. So yes, it was highly prevalent. We do become complacent. I think this is what's happening in parts of Europe as well. People just do not realize the risk, but it's real, it's out there. And again, keep in mind those statistics: 1 in 1,000 severe encephalitis, or 1 to 2 in 1,000 death.
And we can't predict who will have those severe complications.
Absolutely.
So that's why, not only to protect the individual, because you can't predict who's going to get these severe complications, but also to create that herd immunity, as you said.
Yes.